You're in 9th century Scandinavia, and your wife is pregnant. This should be a moment of joy, of hope, of anticipation for new life. But in Viking Age society, pregnancy is a death sentence waiting to happen. Not might be, as the statistics are brutal and unforgiving. Your wife has roughly a 1 in 10 chance of dying during childbirth or from complications shortly after. Your baby has a 50% chance of not living to see their 5th birthday. These aren't worst-case scenarios. This is normal. This is every family, every pregnancy, every birth. Let's start with the pregnancy itself. Your wife discovered she's pregnant because her monthly bleeding stopped. There are no pregnancy tests, no doctors to confirm it, no ultrasounds to check if the baby is developing properly. She just knows because her body tells her, and now she has to survive the next 9 months hoping everything goes right, knowing that so many things can go wrong. Morning sickness hits her hard. She's vomiting multiple times a day, unable to keep food down, losing weight when she needs to be gaining it. There are no anti-nausea medications, no IV fluids if she becomes dehydrated. She just has to endure it, hoping it passes, praying she doesn't vomit so much that she damages something internally. Some women vomit blood, some become so dehydrated they die before the baby is even born. Your wife is one of the lucky ones if she survives this phase. The pregnancy progresses, and your wife's body changes in ways that would concern a modern doctor, but are just accepted as normal here. Her feet and ankles swell to twice their normal size. She can barely walk. She's retaining fluid, which could indicate preeclampsia, a condition that kills both mother and baby if not treated. But treatment doesn't exist. You just watch your wife's body swell and hope it doesn't get worse. Sometimes it does. Sometimes women go into convulsions, seizing uncontrollably, and then they die. You've seen it happen to neighbors. It could happen to your wife. She's exhausted all the time, but she can't rest because there's work to do. Pregnancy doesn't exempt you from labor in Viking society. She still has to cook, clean, tend animals, weave cloth, preserve food, fetch water, and do all the other endless tasks required for survival. Being pregnant just means doing all of this while carrying extra weight, while feeling nauseous, while dealing with back pain and swollen feet and constant fatigue. There is no maternity leave. There is no taking it easy. You work until you physically cannot work anymore. Your wife is malnourished, not because you're not trying to feed her, but because there isn't enough food. It's winter. Supplies are low, and what food exists has to be divided among the entire family. She needs extra calories for the baby, but she's not getting them. She's eating the same meager portions as everyone else, maybe a little more if you can spare it. But it's not enough. Her body is cannibalizing itself to build the baby, taking calcium from her teeth and bones, depleting her iron stores, using up her fat reserves that don't exist because she's never had enough food to build up fat reserves. Her teeth are getting worse. Pregnancy affects calcium levels, and without adequate nutrition, her teeth are literally deteriorating. She'll lose some teeth during or after this pregnancy. Most women in Viking society are missing multiple teeth by their 30s, and pregnancy accelerates this decay. Dental infections are common and can spread to the bloodstream, causing sepsis and death. Your wife has a toothache that's been getting worse for weeks. There's nothing you can do about it except hope it doesn't obsess. As the pregnancy advances, your wife develops what we would call gestational diabetes, though no one knows what that is. She's constantly thirsty, urinating frequently, feeling weak and dizzy. Her body isn't processing sugar correctly. The baby is growing too large, which will make birth even more dangerous. But there's no way to diagnose this, no way to manage it. You just notice that your wife seems sick, that she's struggling more than other pregnant women, and you hope she makes it through. The baby is in breech position. This means the baby is positioned feet first or bottom first instead of head first. In modern medicine, this would result in a C-section. In Viking Age Scandinavia, it means your wife will probably die trying to deliver this baby, and the baby will probably die too. There are midwives who know how to try to turn a breech baby, manually manipulating the mother's abdomen to rotate the baby into the correct position. Sometimes it works. Often it doesn't. Sometimes it causes the placenta to detach prematurely, causing massive bleeding that kills mother and baby within minutes. Your wife goes into labor 3 weeks early. Premature birth is common in malnourished mothers. The baby might not be developed enough to survive outside the womb. The baby's lungs might not be ready. But labor has started, and there's no stopping it. Contractions begin. And now your wife faces hours or days of agony with no guarantee of survival for her or the baby. The midwife arrives. She's an older woman who has attended many births and seen many deaths. Her presence is reassuring, but she's not a doctor. She has no medical training in the modern sense. She has experience and traditional knowledge passed down through generations. Some of it helpful, some of it useless, some of it actively harmful. She feels your wife's abdomen and confirms what you feared. The baby is breech. She'll try to turn it, but she's not optimistic. The midwife attempts to manually rotate the baby. This is excruciating for your wife. She's screaming, begging for it to stop, but the midwife continues because this is the only chance. Your wife is sweating, crying, in more pain than you've ever seen anyone endure. After 20 minutes of manipulation, the midwife stops. The baby hasn't turned. It's still breech. Your wife will have to deliver this baby feet first, which means she'll probably die. Labor continues for 18 hours. Your wife is in the longhouse lying on a birthing stool or on the floor covered with straw and furs. Other women from the community are there to help, but mostly they're just watching, praying, knowing that they might be in this same position soon. Your wife is exhausted beyond measure. She hasn't slept. She's been in active labor for almost a full day. Her body is trying to push out a baby that's positioned wrong, and it's tearing her apart. The bleeding starts. This is bad. This is very bad. Blood is pooling beneath your wife, soaking through the straw. More blood than seems possible for one person to lose. The midwife is trying to stop it, packing cloth between your wife's legs, but it keeps coming. Your wife is becoming pale, her lips turning blue, her breathing shallow. She's going into shock from blood loss. In a modern hospital, she'd receive blood transfusions and emergency surgery. Here, she just bleeds. The baby's foot emerges. This is progress, but it's agonizing progress. The baby is stuck, partially born but unable to be delivered completely. Your wife is pushing with every contraction, but the baby won't come out. Hours pass like this. The baby might already be dead, strangled by the umbilical cord or deprived of oxygen for too long. Your wife might die before the baby is fully born. Everyone in the room knows this is going badly, but there's nothing more they can do. Finally, after 23 hours of labor, the baby is born. But the baby isn't breathing. The midwife holds the infant upside down, slapping its back, trying to stimulate breathing. Nothing. She rubs the baby's chest vigorously. Still nothing. She puts her mouth over the baby's nose and mouth, breathing air into the tiny lungs. This sometimes works. This time it doesn't. Your baby is dead. Your baby was born dead, or died within seconds of birth, and there was nothing anyone could do to save it. Your wife is still bleeding. The placenta needs to be delivered, but it's not coming out. The midwife reaches inside your wife's body, trying to manually extract the placenta, and your wife screams in agony. This is called a retained placenta, and it's one of the leading causes of maternal death. If the placenta doesn't come out, your wife will develop an infection and die within days. The midwife pulls, and finally the placenta tears free, along with more blood, so much blood. Your wife survives the birth, but barely. She's lost an enormous amount of blood. She's weak, barely conscious, unable to move. The other women clean her, change the blood-soaked bedding, try to make her comfortable. But she has no baby. She endured 23 hours of agony and nearly died. And she has nothing to show for it except trauma and grief. This is her third pregnancy. The first baby lived for 2 days before dying of unknown causes. The second baby was stillborn. This is the third dead baby. She's 24 years old. Let's say your wife survives and the baby survives. You now have a living infant in Viking Age Scandinavia, which presents a completely new set of challenges. This baby needs to eat every 2 to 3 hours. Your wife is breastfeeding because there are no alternatives. No formula. No bottles. If your wife can't breastfeed for any reason, if she doesn't produce enough milk, or if she dies during childbirth, you need to find a wet nurse. Another woman who is currently breastfeeding and willing to feed your baby too. If you can't find a wet nurse, your baby starves to death. It's that simple. Breastfeeding is painful. Your wife's nipples crack and bleed. Each feeding is agony for the first few weeks. Sometimes the cracks become infected, leading to mastitis, a painful infection of the breast tissue that causes fever, swelling, and severe pain. Mastitis can progress to a breast abscess, which can be life-threatening if not drained. There are no antibiotics. Your wife just has to endure the pain and hope the infection resolves on its own. The baby is crying constantly. All babies cry, but you're in a longhouse with no soundproofing, no separate rooms, no way to escape the noise. The baby cries because it's hungry. It cries because it's cold. It cries because it's uncomfortable. It cries for reasons you can't determine, and you can't do anything about the crying except try to feed it, try to keep it warm and hope it eventually stops. You're not sleeping. Your wife isn't sleeping. No one in the longhouse is sleeping because the baby is crying every few hours all night long for months. Sudden infant death syndrome is common, though no one knows what causes it. You put your baby down to sleep, and hours later you discover the baby has stopped breathing. No warning, no explanation. The baby was healthy and now the baby is dead. This happens frequently enough that every parent lives in fear of it. You check on your baby constantly, making sure it's still breathing because you know that death can come without warning. The baby develops diarrhea. In a modern context, infant diarrhea is concerning, but manageable. In Viking Age Scandinavia, it's often fatal. The baby becomes dehydrated quickly. Within a day or two, the baby is lethargic, not feeding well, its skin losing elasticity. You try to give the baby water, but it won't drink or can't keep it down. The baby's eyes sink into its skull. Its fontanelle, the soft spot on top of its head, becomes sunken. These are signs of severe dehydration. Without intravenous fluids, which don't exist, the baby will die, and it does. Diarrhea kills countless infants every year. Your baby develops a fever. The baby is hot to the touch, flushed, breathing rapidly, clearly sick. You don't know what's causing the fever. It could be a simple viral infection that will pass. It could be bacterial meningitis that will kill the baby within hours. There's no way to tell. No thermometer to measure the fever. No antibiotics to treat infection. You just hold your sick baby and pray. Sometimes the fever breaks and the baby recovers. Sometimes the baby has a seizure from the high fever and dies. Sometimes the baby simply stops breathing during the night. Respiratory infections are everywhere. Your baby catches a cold from someone in the longhouse because in close quarters with no concept of germ theory, infections spread rapidly. The cold progresses to pneumonia. The baby's breathing becomes labored, wheezing with each breath. The baby's lips turn blue from lack of oxygen. You hold your baby upright, hoping it helps with breathing. The midwife prepares herbal remedies that might help with congestion, but they're not antibiotics. They don't kill bacteria. They just make breathing slightly easier. Your baby fights the infection for days, getting weaker, breathing harder, until finally the baby stops breathing altogether. Let's say your baby survives infancy. This is already remarkable. Your child is now 2 years old, walking, talking, becoming a little person. But survival to age 2 doesn't mean survival to age 5. The dangers don't stop. They just change form. Your 2-year-old is learning to walk around the farmstead, exploring the world with no concept of danger. The longhouse has an open fire pit in the center. There are no safety gates, no barriers. Your child toddles too close to the fire and falls forward. Their hands go into the hot coals. The screaming is immediate and terrible. You pull your child away from the fire, but the damage is done. Their hands are burned, the skin already blistering and peeling away. Burns in Viking Age Scandinavia often lead to infection and death. You have no burn cream, no antibiotics, no sterile bandages. You might have honey, which has some antibacterial properties. You might have certain herbs that are traditionally used for burns, but mostly you just wrap the burned hands in whatever clean cloth you have and hope the wounds don't become infected. They probably will become infected. The child will develop a fever. The burns will ooze pus. The infection will spread through the bloodstream. Your child will die in agony, crying for relief that doesn't exist. Or your child survives the burns but loses the use of their hands. The scarring is so severe that their fingers curl inward, permanently contracted. They can't grip things properly. They can't do manual labor effectively. In a society where everyone must contribute physical labor to survive, a disability like this is devastating. Your child will struggle their entire life, always at a disadvantage, always the weakest member of the community. Your 3-year-old wanders away from the longhouse one afternoon. You're working, distracted for just a few minutes, and when you look up, your child is gone. You search frantically. You call their name. Other family members join the search. You find your child an hour later at the edge of the forest, cold and crying but alive. You're lucky this time. Other times, children wander off and are never found. They get lost in the forest and die of exposure. They fall into a stream and drown. They encounter a wild animal. Young children disappearing and dying is common enough that every parent lives with constant anxiety about keeping their children within sight. Your 4-year-old develops what we would recognize as measles. A rash appears, starting on the face and spreading to the body. Fever spikes dangerously high. The child is miserable, crying, unable to eat or drink. Measles in Viking Age Scandinavia has a high mortality rate, especially in malnourished children. Your child's immune system is already weakened from inadequate nutrition. The measles virus attacks the body ruthlessly. Your child develops complications: ear infections, pneumonia, encephalitis. The fever causes seizures. Your child's body convulses violently while you hold them down, trying to keep them from hurting themselves. The seizures damage the brain. Even if your child survives, they might never be the same. Cognitive delays, behavioral changes, permanent neurological damage. Parasitic infections are universal among children. Every child has intestinal worms. You can sometimes see them in your child's feces. Long white worms writhing in the waste. These parasites steal nutrition from your already malnourished child. Your child's belly is distended, swollen with worms and fluid. Their arms and legs are stick-thin. They're constantly tired, constantly hungry no matter how much they eat, because the parasites are consuming the nutrients before your child's body can absorb them. There are traditional remedies for worms, certain herbs that might kill or expel some parasites, but you never get rid of them completely. Your child will have worms their entire life along with everyone else. It's just another burden the body must carry, another drain on limited resources, another reason why children fail to thrive. Dental problems start early. Your 5-year-old has cavities in their baby teeth. 1 tooth abscesses, the infection creating a painful swelling in the gum. Your child is crying constantly, unable to eat, touching their face where it hurts. The infection can spread to the jawbone, to the bloodstream, to the brain. Children die from dental infections regularly. You try to help by having someone pull the infected tooth, but this is done without anesthesia, without proper tools. Someone holds your screaming child while another person uses pliers to wrench the tooth out of the infected gum. It's traumatic. It's agonizing, and it might not even solve the problem if the infection has already spread. Accidents are constant with young children. Your child falls from a height and breaks an arm. The bone is sticking out through the skin, a compound fracture. This is extremely serious. You try to set the bone, pushing it back into place while your child screams. You splint the arm with sticks and cloth strips, but without proper medical care, without x-rays to ensure correct alignment, without antibiotics to prevent infection, the outcome is grim. The bone might heal crooked, leaving your child with a deformed arm and limited mobility. Or infection might set in around the fracture site, and your child might die from sepsis. Or the bone might heal, but your child develops chronic pain that lasts their entire life. Your child's nutrition is inadequate by any standard. Growing bodies need protein, calcium, vitamins, minerals. Your child is getting some of these nutrients, but not nearly enough. They're shorter than they should be. Their bones are weak, breaking easily from minor falls. They bruise extensively from small impacts because they're deficient in vitamins necessary for blood clotting. Their teeth are malformed and weak because they didn't get enough calcium during tooth development. Their immune system is compromised because chronic malnutrition weakens the body's ability to fight infection. Vitamin D deficiency is universal in Scandinavian winter. Months without sunlight means no vitamin D production in the skin. Children develop rickets, a disease where bones fail to develop properly. Your child's legs bow outward under the weight of their body. Their wrists and ankles are swollen. Their rib cage is deformed. This is painful and permanent. Your child will never have normal bone structure. They'll struggle with mobility their entire life. In severe cases, rickets affects the pelvis, which means your daughter, if she survives to adulthood and becomes pregnant, will have difficulty giving birth because her pelvis is too narrow or malformed. Your child works from the moment they're physically capable. There's no childhood as modern people understand it. No school, no play dates, no toys except perhaps 1 or 2 simple carved objects. Your 5-year-old is expected to help with chores appropriate to their size and strength. Feeding chickens, collecting eggs, carrying small amounts of firewood, stirring the cooking pot, simple weaving tasks. As they get older, the work gets harder. By age 7, children are doing significant labor. By age 10, they're doing nearly adult-level work. This constant labor damages growing bodies. Your child's spine develops abnormally from carrying heavy loads before their skeletal system is fully developed. Their joints wear down prematurely. They develop arthritis as teenagers. Their hands become calloused and scarred from repetitive work and small injuries. Physical deformities from childhood labor are visible in the skeletal remains archaeologists find: vertebrae compressed from carrying weight, joints showing early signs of degenerative disease, bones that healed poorly from fractures sustained during work accidents. Education doesn't exist for common children. Your child will never learn to read or write. These skills are limited to the very wealthy or to religious functionaries. Your child will never know literature, poetry, written history, mathematics beyond basic counting. Their world is entirely oral and experiential. They learn by watching adults and copying their actions. They learn through trial and error. They learn through painful consequences when they make mistakes. Your child's entire existence is bounded by survival. They don't dream of becoming something when they grow up, because there is no becoming something. They will be a farmer like you or a farmer's wife, doing the same work you do, living in the same conditions you live in, probably on this same farmstead or one very close by. There is no social mobility, no opportunity for advancement, no hope for a better life. This is it. This is all there is and all there ever will be. The psychological impact of this existence on children is profound but rarely discussed. Imagine being a child and watching your siblings die. This isn't unusual. This is normal. Most families lose multiple children. You might be one of 7 children born, but only 3 survive to adulthood. You watch your baby brother die from diarrhea. You watch your older sister die from infection after a cut on her foot. You watch your younger sister die from fever. Death is your constant companion from your earliest memories. Children in Viking society grow up with no illusion that the world is safe or fair, or that adults can protect them. They see too much death, too much suffering, too much random tragedy to believe in security. They learn early that life is brutal, short, and filled with pain. This creates a particular kind of hardness, a pragmatic acceptance of suffering that modern people would find disturbing.